obviously we are all trying to navigate what is now a new normal, and no one here is unfamiliar with the strain that COVID-19 is placing on our community, and specifically our employers and employees. So the question really is, how do we come back? How do you do that safely? And as we operate under safer at home orders, and as we slowly emerge from those orders, one thing that is certain, legal guidance and administrative recommendations are changing every minute of every day. And so we are keeping in touch with those. And these are a couple of things that I think you all will recognize. You know, businesses here have been categorized. They've been categorized as essential businesses and services or non-essential. But the reality is you all have employees. And so what is your first step? And the first step and the primary focus, I believe, is safety of your business and your employees and what guidance is out there. I will say that first and foremost, one thing that is consistent among all of your administrative agencies, CDC, Department of Labor, and local health departments, if your employees are sick, they should be encouraged to stay home. So then the question is, and you know, you have a sick employee at work, can you send them home? The answer to that question is yes, you can send them home. If they are confirmed sick or if they are in fact symptomatic. And what was interesting, do you know the symptoms? Everybody, the symptoms are very similar, I understand, to the flu and very similar to even allergies, and we live in Memphis. So the CDC actually published a new set of symptomatic symptom guidelines yesterday, but just as a recap, your Centers for Disease Control has said fever, cough, sore throat were original symptoms, and they've added chills, shortness of breath, muscle pain, headache, and new loss of taste or smell. So those are symptoms that if your employees have, they can voluntarily stay home, or they can in fact be asked to go home for the safety of those that are present in the business establishment or the office. A couple of other important things that you may have heard and will be important as we discuss implementing new policies. You know, you hear on the news a lot of different things like self-observation, self-monitoring, isolation, and quarantine. And just a recap at a very high level, and from someone who does not have a medical degree, this is what the guidance is out there saying about what each of those mean. Self-observation means you're staying in touch with what your personal symptoms might or might not be. Do I have a cough? Do I have shortness of breath? Do I have a sore throat? That self-observation, self-monitoring is the same thing, but you are also taking your temperature. So fever, obviously, being one of the symptoms. Isolation. Isolation can be, well, just that, isolation of an individual or a group of people. It can be ordered by virtue of a health directive, federal, state, or local agency, or it can be voluntarily. You can volunteer to self-isolate. Quarantine is an instruction to do the isolation by a federal, state, or local agency. So sometimes isolation is used interchangeably, but nonetheless, that might come from a healthcare provider or might come from your employees specifically. Quarantine will come from a healthcare provider or a federal, state, or local agency. So you now have the symptoms, you now have levels of monitoring. The next thing that an employer should be doing is evaluating the risk of transmission. And the reason that this is something that I'm talking to you about is that these administrative agencies that are out there, your Department of Labor, your Centers for Disease Control, and your local health department, they want you to evaluate those areas of risk. And it's important because employers evaluate risk and make a plan through policies. So if you can highlight your areas of risk, you can potentially address those risks in policies or procedures. So we have the OSHA administration putting out these levels of risk assessment. You want to assess risk between employees, contact between employees and patrons. You want to assess the risk of your employees and what you do if they become sick or symptomatic. You also want to maintain a certain level of understanding with non-occupational risk factors, meaning community transmission, and some factors that might play into that. Consider population density. New York obviously has a very high population density. In Memphis and Shelby County, our population is less dense, but there are some areas where population is quite dense. So that might factor in depending on where your business is. Community levels of infection, that's something that's being reported at the local, state, and national level every day. So you might want to take note of how that is progressing. And then you want to address each of those risks with specific controls. What can I do to separate my employees from one another? What can I do to separate my employees from patrons or citizens coming into the establishment that might limit transmission risk? And then the very next step after you have walked through each of those factors would be develop policies. And the CDC has asked that everyone develop internal policies regarding health, safety, and hygiene. Personal hygiene, for example, you might have the 6 feet social distancing and hand washing. One term of art that I have heard, and maybe it was in existence before COVID-19, but one thing that I have heard is respiratory etiquette. Where are you breathing, folks? You know, where are you coughing? How are you sneezing? And are you, limiting that contact between you and another person? I will say that they have policies and guidance out there regarding temperature checking. You can take the temperature of your employees. It is typically been a medical procedure, but it is also non-invasive, and under the circumstances, you have support from the Department of Labor and the EEOC in terms of doing that. But they also caution you that taking the temperature is not necessarily indicative of if they don't have a temperature, they still might have COVID-19. So they're asking that you also evaluate the other symptoms and consider the risk factors that we talked about before to mitigate transmission inside your office. A few other things that they're talking about doing in terms of policy making and limiting transmission. Webinars, what we're doing right now, is an active step in limiting transmission. Conference calls, and then also scheduling enhanced cleaning inside your office and having that be a part of your mitigation effort is becoming more and more routine. I will say that there is still guidance out there that if you are in public or within in an environment where you might come around 6 feet of your coworkers wearing a mask. It is also important to know that you cannot make your staff wear masks because there is also a concern that there might be an underlying medical condition. So the terms are encourage, encourage, encourage. We can, however, put policies in place that adhere to all other recommendations of the Centers for Disease Control. One thing that I would highlight in terms of policy making and limiting risk to your employees, you can also require that individuals use their own office equipment and not anybody else's. Use your own stuff. Basic infection control is what all of this falls into a category. So you have your hygiene related policies, but what about your leave related policies? And it was spoken on a minute ago, but you do have enhanced leave policies now available to you. But what the guidance is consistent through all administrative agencies is saying is what alternative method of working can you come up with to ensure that your business carries on, but also limit transmission. So you have your alternative work and sick leave policies. They are asking, and when I say they, the Centers for Disease Control has published this as well as the U.S. Department of Labor, that where you can limit contact through telecommuting or teleworking, you are encouraged to do so. Furthermore, you are also encouraged to have liberal sick leave policies. Right now, you might have employees who are sick themselves, or they might be taking care of someone else who is sick. So flexible sick leave. The one thing that is important is that when you're implementing these policies, you are not to discriminate against your employees. You should not make, race-based decisions. You should not make sex-based decisions. The policies have to be absolutely neutral as you navigate into this space. So you're looking at applicability of flexible working arrangements and flexible sick leave arrangements because your employees either will be sick themselves at some point or another or not, or they might be dealing with a family member who is sick. And where you have policies, where you have guidance written, it is consistent, and it is available to everyone at a neutral level. Flexible sick leave, you might consider using accrued leave to cover isolation, to cover care of a child, and all of these things now have become enhanced and expanded sick leave policies through the Family First Corona Response Act. You also have enhanced family medical leave. And what's interesting about these, let's get back to an organized thought process here. But you have expanded family medical leave and you have expanded sick leave now through the Family First Coronavirus Response Act, the FFCRA. So the sick leave policy is up to 80 hours of leave, and the expanded family medical leave is 10 weeks of pay, but with the first 2 weeks of a 12-week span being unpaid. Addressing first the Expanded Family Medical Leave Act, simply speaking, that's expanded to cover the care of a child or a family member care of a child rather, that has their school or their daycare facility closed in response to the COVID-19 pandemic. The first 2 weeks of that leave are unpaid by the government, or by the employer, but can be covered by the employee with available leave balances. So who does that apply to, the Expanded Family Medical Leave Act? That applies to certain public employers as well as businesses with fewer than 500 employees. There are exceptions in place for small businesses with fewer than 50 employees, where there is some concern that paying for this benefit would hurt the viability of the business itself. Expanded family medical or expanded sick leave is broken into two categories. The first category is you're sick yourself, and you have up to 80 hours of paid leave at your regular rate of pay, and there are certain caps in place that your leave can't exceed. Or the second category of expanded sick leave is that you are caring for someone that is sick or in fact subject to a federal, state, or local directive to isolate or quarantine at home. At that category, you have 2/3 of your pay or applicable minimum wage with also certain caps in place. So there are basically three categories of major solutions for covering absenteeism at your office. One is your creative, flexible work schedule or your own flex sick leave policies. And I highly recommend where you are becoming creative, you write it down and you publish it to your staff. Then the next would be the expanded family medical leave and the expanded sick leave. These are three avenues available to you as you try to navigate reopening your establishment. Flexible work solutions. We covered telecommuting. We covered, there's also the concept of alternate staffing. I've seen on the news where, you have groups of people that are divided into basically teams, and those teams report, an alternating days so as to have so that you have opportunities to clean your facility. In order to wrap up, I think if I could leave you with one highlight, and that your lawyers will appreciate this very much, is where you are changing policies as written, you should write these amendments and publish them to your staff and rely on them. Policies are effective in showing employers have attempted to cure a problem. Policies, when they're enforced, become an effective tool that you can rely on later. We can cover, if need, you know, can you ask your employees to get a COVID-19 test under limited circumstances? Yes, you can. If you have a job offer out there to someone who is potentially sick, you can delay their start date. There are avenues available to each of you. I can send links to anyone who needs them with specific guidance from all of these agencies, Department of Labor, OSHA, and EEOC. But when in doubt, contact your lawyer. That would be my advice.